There,
Here, today we are going to look into the role of yoga in major depressive disorder and also try to understand depression from yoga perspective. Okay. Yes. Depression, as you all know, is a mood disorder characterized by loss of interest or pleasure in daily activities. Specifically, the activities which I previously used to enjoy. So if in that kind of a activity, if what happened? Where is that? Why it has moved? Okay, so in daily activities for more than 2 weeks. Depression is also more common in women as compared to men. In the prevalence, you can see that um, 1 woman out of 8 is affected by depression, whereas in men it is 1 in 12. So you can see the ratio is 3:2. 76% and 85% of people in low and middle income countries receive no treatment due to social stigma and due to lack of resources. We actually, are running a project in the rural community, and what we observed was that people really, are not aware that they are depressed, that there is a professional help that is there. They think that it is natural because I am going through some situation, I do not feel like it. And even families, they consider that the person has become very lazy, person is not doing activity, person is doing some excuse, and it is like a excuse not to do the work. So that is why more and more awareness is the key, which is required. And prevalence is quite high, suicide rates are increasing, and suicide is becoming a leading cause. Recently you saw people, students who are studying in Kota in Rajasthan, preparing for the entrance exam, very tough entrance exam in India. There was a very high number of suicides that were happening in that particular age group and in those people. So dear friends, depression, very important to understand that according to the DSM-5 criteria, the symptoms should persist for at least 2 weeks. It is like I feel low today and tomorrow I'm okay, is not depression. Anybody can feel like that. But if it persists, if it is a pervasive low mood and it remains for more than 2 weeks, then you call it depression. Also, the loss of interest should be in the activity in which you were previously interested. Like I used to enjoy watching movie, play cricket or play tennis, and now I do not feel like doing all those activities. Then it is a low mood or loss of interest. So reduced depressed mood and decreased interest. These are two core symptoms of depression. Apart from it, there is a variable change in appetite. Either people gain too much weight or they lose too much weight. Suddenly you see, oh my God, this person has become so fat, but he may be depressed. Or the person has lost a lot of weight, more than 10 kg in 6 months, and he may be depressed. So there are both things possible. Increase in appetite, reduction in appetite. Both are there. Similarly, in sleep. In one type, you can see that people do not sleep at all or get early morning awakening, and then after that, they cannot sleep. Typically, they will get up early in the morning, 3 o'clock, 4 a.m. And that is the worst phase at which they feel very bad. And at that time, whenever the suicides happen, this is the time zone when maximum number of suicides also take place. And the other category is where people can't even come out of the bed and there is hypersomnia. They just keep sleeping, but they are actually depressed. Similarly, people also report either psychomotor agitation, irritability, or very, retardation in their psychomotor activity. It means for them, even doing a very small activity, getting up, sitting on a chair, as soon as they come into your cabin, you can recognize that they have to take a lot of energy to do a small work. That is known as psychomotor retardation. Fatigue and loss of energy, feelings that they are worthless, that they have no hope that they will be able to come out of this situation, and nobody can help them. Worthlessness, hopelessness, helplessness. This is what characterizes depression. And there is a very strong underlying feeling of guilt. Guilt feeling also is very, very commonly reported in people who are depressed. Along with it, there are certain cognitive symptoms in a diminished ability to concentrate, think, and take decisions in life. Similarly, people also report thoughts of death or suicide, or suicidal ideations are there. If there is a suicide attempt, then especially the yoga therapists have to be very, very careful, and you should definitely take professional help, refer them to psychiatrists, psychologists, and make sure that patient doesn't come alone for the yoga sessions, and there is always a caretaker with the patient. Even when they are admitted in the ward, if there is a suicide risk, then in the ward, you should not keep sharp objects. You should not keep very, high lying fan where patient can put something and kill himself. The windows also should not be such that they can jump out. So all these kind of, in our wards, we take all these precautions when we design wards in a psychiatric setup. Now, looking at it from the yoga perspective, my dear friends, yoga understands depression to be a very spiritual kind of a illness. So, if you look at the yoga literature, there are examples that people got into depression, and when they came out of depression, they were much more evolved. So, depression somewhere, is kind of a condition where person is searching the purpose of life, which is a very deep, spiritual kind of a question. We see that Arjuna was in that kind of a state when the famous yoga text, of Bhagavad Gita was written, where Krishna, Lord Krishna, became his savior, his psychotherapist, and gave him 18 sessions to come out of his depression. In fact, the very first chapter of Bhagavad Gita is known as Arjuna Vishada Yoga. It means the yoga of depression of Arjuna. It means that depression was also considered as a yoga. What does it mean? It means that life has put you in some situation through which life wants you to evolve. And there are many patients, like Aditi was sharing with you, when they come out of this, then they actually thank their depression. Like you remember the case report of Soumya. Now she has completely become a yoga professional. She is helping many more people, and she says that yoga has given me a new life. If I was not depressed, I would have never come towards yoga. So in this way, this is one kind of a illness where person is cognitively able to understand everything. Person knows, that is completely aware that what is happening with him. He has very deep questions about why he should live, why he should survive, what is the purpose of his existence. And these are the very fundamental deep questions which make a fertile ground for the science of yoga to grow. So that is why Gautama the Buddha also was very depressed. He was not finding any interest in anything that he was doing. He had all the pleasures in this world. He had so many wives. His father could give him whatever he wanted, but he left everything like a monk in search of happiness, in search of real satisfaction. Similarly, in Indian, philosophy, we also see Lord Rama. Rama was also in his teenage, very sensitive personality. He couldn't, say something bad to anybody, couldn't think of anything wrong even about his enemies. Very gentle, very beautiful, patient kind of a personality. And this person also got into the same stage that ultimately what is going to happen? I am going to grow old, I am going to get diseases, and I am going to die. So what is the whole purpose? Why should I become the king? Why should I take responsibility? Why should I do so much of drama when ultimately everything is going to become a big zero? So his questions were so sharp that his father Dashratha was not able to answer them. And then he refers him to Yoga Vasishtha, the guru. And then he stayed with Vasishtha for 2 years. And there was a conversation between Rama and Vasishtha. And it is written in the form of a yoga book known as the Yoga Vasishtha. The book name is itself Yoga Vasishtha, The Way and the Vision of Vasishtha. That is the book. And from here, in this book only, the concept of Adhi, Vyadhi, Anadhija Vyadhi, all those concepts that we discuss actually came from that book, which is the conversation between Rama and Vasishtha. Similarly, Bhrigu in Taittiriya Upanishad also gets into that kind of a stage. He has very deep question about who am I, why am I, what is my existence? And it is here that exploring that, when he does tapas, he explores that human beings have 5 layers of existence. That is the Panchakosha model. You understand? So you see, the very secrets of yoga therapy emerged because some people back then were depressed. And then they interacted, and in solving their depression, yoga as a science, got its depth, and those valuable books and the Bhagavad Gita, Yoga Vasishtha, Taittiriya Upanishad, Gautam Buddha, all philosophy have come because these people had depression. That is why Bhagavad Gita also begins with the yoga of the depression of Arjuna. It means that now life wants you to enter into the path of spirituality. That is why you have become depressed. This is how yoga looks at depression. Okay. Another thing, which is very beautiful in depression, which inherently puts it on the path of yoga, is fill in the blanks. You have to answer. What else is there in depression which puts it in alignment with yoga? Is there anything? In the philosophy of yoga and in the disease depression, there is one thing that is going in the same line.
Solitude.
Purpose of life, sir. Purpose of life.
Purpose of life, these people don't know.
Self-reflection.
I am telling commonality. Huh?
Loss of interest.
Self-reflection, sir.
One by one. Aditya ji?
Sir, loss of interest.
Loss
Vairagya.
of interest. Huh? In
Vairagya.
yoga also there is loss of interest.
In depression.
Realization.
Self-attachment from external environment or external world.
Solitude, detachment.
Solitude, detachment, less involvement with external world.
Self-realization.
Non-doing.
Self-realization is not
Reflection.
there in depression, madam. So I'm telling
Non-doing.
what is common. Non-doing. People become very humble. Okay, I am nothing. We say in meditation, no, I am nothing. I do nothing. These people naturally become like that.
Lack of ego.
So there is humbleness in this disease. You become humble. When you are depressed, you become humble. Number 1. Number 2, there is vairagya. There is natural, that kind of a, as people said, that there is detachment coming and all those things. But only thing is, they are not able to do abhyasa. In yoga, to grow, you need 2 things. One is detachment, lack of indulgence, which is there. But in yoga also, there is a component of practice, which is known as abhyasa. So yoga has 2 wings. One is detachment, other is practice. In depression, one wing is very strong, which is detachment. But the other wing, the practice is not there. Why? Because these people have developed detachment. They have been able to remove the energy that is moving outward into the world. They have been able to prevent that, but they have not been able to channelize this energy in a more constructive way in which they can evolve further in life. You understand? So they are able to withdraw, but they are not able to move in the right direction, so they are stuck. And the only direction that these people have to move is the direction of further deeper exploration of the philosophy of life. And yoga is a very, very comprehensive science. Depending on the personality of the person, you can take him onto path of Raj Yoga, which is the path of systematic yoga practice. You can take him onto the path of Jnana Yoga, where intellectually dominant people, who am I? What is the purpose? You can go very deep. And if you see in Bhagavad Gita, after listening to all the symptoms of Arjuna in the first chapter, in the second chapter, what is the name of second chapter of Bhagavad Gita? Anyone? First chapter is Arjuna Vishada Yoga, the yoga of the depression of Arjuna. Second chapter is? Anyone? मेरे प्यारे भाइयों, आप में कुछ योगा के एक्सपर्ट भी है ना?
Sankhya Yoga, sir.
Sankhya. Sankhya is jnana. Sankhya is the path of jnana, going into the very philosophy. Then you see the third chapter as Karma Yoga. So Krishna very systematically, step by step takes him. He first thinks, okay, let me see if the path of analysis works. So in Sankhya Yoga, he actually gives him the very core of existence, gives him the knowledge of the self. This is known as Atman. The famous shloka, Nayanam chindanti shastrani, Nayanam dahati pavakaha, na chayanam kledayantyaapaha, na shoshayati marta. This is the famous shloka that comes in second chapter. So, inquiry into the nature of the true self. This is the path that can take a person out of depression if the person is intellect dominant. Is it possible for my wonderful psychologists to develop a program of exploring thyself? Exploring thyself for getting out of depression. See, I want to kill myself, but first I should know who am I. Okay, so I tell patients, okay, fine, you want to kill yourself, but let us first discuss who you are. Then you can kill yourself. So, I am going to share a paper with you, which we have written in the exact very depth of this concept. The paper is written in our one series that we published in Asian Journal of Psychiatry, where we started with the situation of Arjuna, how it was in the beginning, and then how Krishna explored the path of Jnana Yoga, and what are the different domains in the psychotherapy that you can systematically explore, and how you can develop several techniques to explore this path further. Okay, so this is the paper that all of you should read, and that paper is also going to be there in the syllabus, which is a part of psychotherapy that we are talking about in the next week. Then when you look at this kind of a background, that yoga puts depression as a illness which is highly spiritual, and yoga respects people respect. We respect all patients who come to us, but we have very special respect towards people who are depressed, because we feel that they are potential ambassadors of yoga. And you see that our patients who are depressed, they actually, when they really get into the path of yoga, they feel that they got a new life. And that is why these patients take up yoga in a very big way. Many of our depressed patients show that. Aditi also shared that with me, that a lot of people were interested in taking yoga as a profession or going deeper into it. So we just initiate them, give them a direction, and these people go in very depth of it. And they not only that they come out of depression, but they help many more people around them when they come out. So vairagya is there, but abhyasa is not there. Practice is not there. Can we give practice to them? This is very important. And the practice has to be given by selecting which path of yoga you want to give him. You want to give him Jnana Yoga, you want to give him Karma Yoga, yoga of action, you want to give him yoga of emotion regulation, or you want to give him yoga of that is bhakti, or you want to give him the yoga, what we say as Raj Yoga, that is yoga of systematic practice. In the Panchakosha model, I showed you yesterday also, we discussed that there are 5 layers of existence, correct? What is happening in depression? In depression, whatever I am doing, I am not able to feel happy. Earlier, the same thing was making me happy, correct? It means, what has happened in my Panchakosha? Anyone?
Sir,
Sir,
Anandamaya
my
Kosha is clouded.
Wonderful. So Anandamaya
Then-
Kosha is completely clouded. And when there are too many clouds, then it rains. That's why these people keep crying. When there are too many clouds, they rain. And that is why these people keep crying. So there is lot of vishada, lot of shoka, lot of pain. And we have to systematically try to understand that, make them understand that the peace, the happiness that they are searching is right there within them. Only that the clouds have become very dense. So with very dense clouds, there is darkness. Okay? There is no light. So depression is characterized by darkness. And yoga is something which brings light in the form of insight. So Patanjali says, by doing pranayama, kshiyate prakash avaranam. It removes the avarana of the prakasha. It means the darkness is removed by pranayama. And similarly, definitely at the Manomaya Kosha level, you have to resolve the conflicts. In that, psychotherapy also works in thinning out the Manomaya Kosha. But along with that, you also need deeper exploration of the purpose of life. If that is not there in psychotherapy, these people will recur again and again. Okay? Because fundamentally, their question is about life. Because they cannot answer it, they want to die. So we have to have strong philosophical angle into it. It is not that it is only for the believers. When I will share the Know Thyself chapter with you, you will see that even non-believers can take that path. Okay, so in yogic understanding of depression, you also see that the tamas guna increases because there is lot of clouding in the Manomaya Kosha. There is lot of darkness. There is increase in the tamo guna. But these people in our analysis have also shown that their sattva guna is also high. Only thing they report is very low rajas guna. So what is this sattva, rajas, tamas? In a very simple term, I can tell you, rajas means fire. Fire means tendency to remain active all the time. Rajasic kind of mind is a hyperactive mind which cannot sit still. This mind always wants some or the other task. If you give him one task, he will do it. And then as soon as that is finished, they want another task. If rajas becomes too much, then before finishing one task, one will get into another task. Then before finishing that task, one will get into third task, then come back to the first task. So they will keep switching between their tasks. Their task networks are hyperactive and their DMN is interrupted by the task. So their DMN is not able to rest. In their rest also, the task keeps coming in. So such people, even when they sleep in the night, they keep planning what happened today, what I have to do tomorrow. And by this way, thinking, whole night goes off. Only superficially they are sleeping, but inside their mind keeps working. So this is rajas. Rajas is task-oriented speed of the mind. And why they are doing it? They are doing it because they are attached to the fruits of their actions. They want to succeed at any cost. Whatever activity they do it very intensely. They put everything into it. And after that, they get very exhausted. These are typical Rajasic people. Okay?
Sir, is it connected somewhere to ADHD, sir?
ADHD we have done research, we have found that ADHD people do show higher Rajas scores, but they also show high Tamas score in the background. Here the combination is Tamas and Sattva. So first understand what is Rajas, what is Tamas, and what is Sattva. Rajas I already explained to you. In a very simple term, I can tell you, you imagine a vehicle. The accelerator in the vehicle is Rajas. The brake in your car is Tamas. And the clutch, which allows smooth shifting from one to another, is the Sattva. Okay, Sattva knows when Rajas is required, Rajas will be there. When Tamas is required, Tamas will be there. Rajas people also have this quality, Sattva people also have this quality. They are more flexible. Cognitively, they are more flexible. But there is one weakness with Sattva. Sattva is too much attached to goodness. So, Sattvic personality is not, will suffer himself, but will not allow the other to suffer. So, these are people who are highly pro-social. And they have a tendency to be violent towards themselves. Okay. So, if people around them do big mistakes, they can forgive easily. But if they do even a small mistake, they cannot forgive themselves. For them, their mistakes are huge. Others' mistakes are small. And that is why they become very, very prone for guilt. Any small thing can generate guilt in a Sattvic personality. They are very good people, very amicable, and they do not have that kind of a assertive power. They give away, to others' demands. But this kind of a trait in yoga also leads to its own stressors. It generates its own stress because they are not able to put across their own point of view. They are always driven by more dominant personalities around them. So we have observed that people who get depressed have both Tamas guna as well as Sattva guna. Because of the Tamas guna, these people are not attached to any activity. They are more attached to sleep, inactivity, inaction, withdrawn. So Tamas has two kind of categories. One is a withdrawn Tamas, where the Tamas is complete inaction. You do not fulfill the duties that are allotted to you. You postpone things. There is procrastination. Things that can be done in 3 days will be done in 1 month. So all those categories belong to Tamas. Also, in Tamas, there is a kind of a cognitive rigidity. Rigidity means that the tamasic person will find it difficult to change his ideas. And here it will be like they are more prone for certain delusions also. So a tamasic personality is delusion prone personality. And their way of changing their way of thinking will be more difficult. Sattvic is more flexible, pro-social, attached to goodness, but suffers because they are too harsh on themselves. And tamasic people generally have a tendency of being harsh to others. So a tamasic person is a person, as soon as something wrong happens, he has already found out whom to blame. So his fingers are always pointing towards others. Okay. So these people are exact opposite actually. Their own mistakes, no matter how big they are, it is very small for them. Others' mistake, even if they are minor, they are huge. And these people, if the Tamas score is very high, they will never accept their mistake or ask for a sorry. It is even if it is their mistake, the other person has to say sorry to them. So these are typical personalities that we come across. So this is Tamas. Tamas can manifest in two forms. One is complete withdrawal, laziness, not doing anything, and other in terms of a kind of a dominant aggression which is driven towards hurting others. They derive pleasure when others are hurt. Okay, a kind of a sadistic kind of a tendency comes in tamas. So here, all the terrorists who attack, they fall under the tamasic category. Even they are not lazy, they are also very active. So then how do you differentiate the activity of rajas and the activity of destructive tamas? Anyone? Can anyone?
So based on outcome.
In outcome, tamas will be more destructive, but rajas will be more selfish. He doesn't want to hurt others, but he wants to be number one. So credit should come to me. I do not mind if others also get little bit of credit. But for a tamasic person, the pleasure is that other person should not get. For him, whether I get or not, it is okay. But that fellow should not get. This is tamasic mentality. Rajasic mentality is others get or not, I don't mind, but I should get. So Rajasic person, therefore, Bhagavad Gita says, Urdhvam gachanti sattvastaha. Sattvic person rises up in evolution. Madhye tishtanti rajasa. Rajasic person remains in the middle. Jaganya guna vrittisthaha adho gachanti tamasaha. Tamasic person caught up in this loop of destructive thoughts, they keep going down and down in their evolution and reach the level of animals. Okay. So yoga is very clear about it. So here in depression, we see that the tamas, which is of a withdrawn kind of a tamas, is high. But fundamentally, these are sattvic people. And if you go back in their history, we also typically see that these people actually go through a rajasic phase. Before going into the tamas, these people are actually high achiever, very brilliant. And then they get into some sort of a phase of life where whatever they are doing, it is not giving them desired results. So after becoming very, very rajasic and putting lot of effort, trying again and again, when they do not succeed, then their rajas gets into a state of tamas. Okay. So this is how there is a past history of being rajasic. Currently, when they come, they show increased tamas, and basically their core personality is a sattvic personality. A sattvic personality wanted to achieve many things. After repeatedly trying, nothing worked out, started getting into tamas. Because basically, people around them take them for granted. And this is how this is yogic understanding. From the Hatha Yoga point of view, as Carolina said, the right is the tha, the ha, and the left is the tha. So we see that the left-sided, there is an imbalance in the energy, right and left. For them, the left side is overactive. Left nostril flows more frequently, and they have left nostril dominance most of the time. And because of this left energy dominance, they get less energy, and there is a more tendency to remain withdrawn and less active. So therefore, we give them right nostril breathing to activate the right side also. See, another thing in yoga therapy is yoga doesn't believe in blocking anything. In modern medicine, you block. In yoga and Ayurveda, you do not block. What you do is you increase the opposite. This is a fundamental difference in approach of therapy. In yoga, you always focus on increasing the opposite. Whereas in...
Daddy!
Can you hear me? Carolina?
Yes. Yes, sorry. Sorry, Professor. Yes, I can hear you.
Okay. And then you can also see that there is hypofrontality here. Hypofrontality means that the Vijnanamaya Kosha, Vijnanamaya Kosha is also covered. Patient lacks the decision-making power. And is clouding of the understanding, and those phenomena are there. This is how yoga looks at depression. Please note down this slide. There will be MCQs. I am telling you, please read properly. Okay. Then this is
Dr. Hemant, Hemant, you were talking about hypofrontality. Can you just explain that one more time? Like what exactly happened?
See, hypofrontality
The last point.
is this right and the left prefrontal cortices. So if you look at our brain, the way our brains have evolved, This area of the cortex is known as neocortex. Okay.
Mhm.
Neocortex. What is neocortex? We have hindbrain, midbrain, and forebrain. The hindbrain and midbrain area are primitive. They are present in reptiles also. They are present in primates also. But as human being evolved, human beings have the heaviest brain. You know, so the maximum mass that comes is from this prefrontal area. Now, this is something which makes human being unique because human beings have the largest PFCs. It is even larger than the elephant, the mass of the brain. So, this particular area of the brain is actually responsible for decision making, control over your impulsive behavior. Like you have an impulse of expressing the animal within you, this area tells no, you should not do it. This is not correct. The discrimination power of what is right, what is wrong, and to be able to put a break in your impulsive activity is the role of this area of the brain. And you saw that in that paper, it was shown that as compared to exercise, yoga increased the size of the left prefrontal cortex. Especially left one is associated with more positive emotions and the right is with little more negative emotions. But both of them overall have a inhibitory kind of a function. So the left enhances happiness. They say the happiness emotion is pursued by the left PFC. And both PFCs are sending inhibitory neurotransmitters to the midbrain and to the lower brain areas, which are amygdala, which is deactivated by chanting Om. So yoga deactivates the lower brain areas and yoga activates the PFCs, the Vijnanamaya Kosha areas. So in depression also there is little deactivation here because these people, their Vijnanamaya Kosha is completely covered by the emotion. The emotional layer becomes too thick. And that is why we have to focus on increasing the prefrontal activation. In our research, it was my own MD dissertation. I published it in Frontiers in Psychiatry, where I was able to demonstrate that a fast yogic breathing known as Kapala Bhati. Kapala means what? In Sanskrit word, Kapala means what?
Is it the forehead, sir?
Yes. Kapala.
Forehead, it is forehead.
Forehead. Forehead is known as
Mhm.
Kapala.
Kapal.
And Bhati means
Shining, skull shining.
shining. So the name of the practice is forehead shining breath or skull shining breath. So I was wondering, why did Sage give them this kind of name to this practice? So then what I did was I applied this FNIRS device to measure the oxygenation in the prefrontal cortices. And I observed that if your rate increases 90 per minute and above, as soon as you cross 90, it increases the oxygenation in bilateral PFC. Okay, so this is a published paper. And then I understood that forehead shining breath means breath that enhances oxygenation in the prefrontal cortex. This is what our sages meant. So this is very amazing. So fast breathing practices play a very important role. Yes, Nikita.
Before interrupting, then I'll forget the question only. Sir, when you say that 90 per minute, have you ever tried yourself so that we can get a,
We will teach you.
first-hand information?
We are going to teach you that particular practice, and it is possible to go up to 120 per minute also, one stroke in 2 seconds also. People have done it. So we will start. We will teach you. We will start with 30, go to 60, take you to 90, and we'll try up to take you up to 120 also. So it is there in the practical session.
But how was your experience, sir? I mean, like first-hand experience, if I want to know about you, then that's why I'm asking.
So I can easily do it. So it is not at all a very difficult practice. I think you will also be able to do it. We can make it nasal and go do it even more faster. There is something called as nasal flutter where hyperventilation can even exceed 150. So there are techniques in yoga. The more superficial you make it, the faster it becomes. So we will talk about it.
Oh, thank you.
Fine. So this is the research that Aditi was talking, and this is published in Asian Journal of Psychiatry. Very good impact journal, impact factor of 11 actually. So you see, there is significant increase in mature BDNF level, decrease in pro BDNF to mature BDNF after therapy. So she is actually going up to the genetic expression from where the pro BDNF is converted to BDNF, and BDNF is the chemical that increases neuroplasticity. It means your ability of your brain to form new connection and become thick. More BDNF, more thick your brain will become. So we say that, okay, yoga increases thickness. There is a biological mechanism that the depression module, if you practice regularly in 3 months, you are actually, some biological changes are happening within you, which are going to increase your prefrontal activation and the thickness in the brain. Meditation and the power of Om. Again and again, we are repeatedly emphasizing this, that Om chanting also deactivated the limbic area. Another MCQ. Om chanting deactivated the limbic area, and it is how the lower brain, middle brain is calmed down by yoga, whereas the neocortex is activated and thickened by yoga. It means you become more human, less animal. So this is what Professor Phadke was also talking. No, what is unique about yoga? It is from human being to being human. The wisdom that is added by adopting this science into your life. There is a biological basis that why the humanity needs yoga now. Why yoga is becoming so popular over the globe. So this is what Dr. Shiv also presented, limbic deactivation. This is the area of the brain which generates all, anger, jealousy, frustration, all negative emotions are released from here, fear. It is just deactivated by 10 rounds of Om chanting. O and Ma in the ratio 1:2. So you do Om chanting, after that do fast breathing. It means you have deactivated lower brain area, activated higher brain area. It means it will now enhance your decision making. You will not take it impulsively. You will be more rational. So whenever you are confused, do fast yogic breathing, chant Om. You will see that you will get more clarity in your thinking. Yes, Revati.
Sir, what is that about the gunas, sir? What is the ideal type of amount of percentage of each guna that a person should have so that you can lead a successful life or something like that from your side, sir, opinion?
See, Revati, ideally, what is required, Krishna says that all the 3 gunas are 3 chains. Trividha gunehe nibadnati dehinam avyayam. So these 3 gunas are 3 chains which are binding the observer to the body. Tamas is the chain made up of iron. Sattva is the chain made up of gold. Rajas is the chain made up of silver. So there is no ideal combination. The only way is to develop a metacognitive awareness of these 3 gunas. Then you transcend the gunas. That is known as gunatita. In Bhagavad Gita, 14th chapter, there is a very beautiful depiction of these 3 gunas. 14th chapter is called as Gunatraya Vibhaga Yoga. The yoga of the 3 gunas and the transcendental. It can also become a very important avenue of psychotherapy. Dr. Jyotsna Agrawal was talking about sattva enhancement therapy. But I talk about metacognitive therapy for awareness of the gunas. Can any one of you take up this as your PhD project? So you are welcome. No, I am there with whatever support you need. Metacognitive therapy for guna awareness. Okay, so this already, Bharat has discussed that we had A, U, Ma. A is wakeful, it goes out. U is thinking, which goes into the consciousness projects itself in the mental space. And Ma is when the consciousness is completely withdrawn inwards. We had a discussion about it before, right? The 3 modes of Om. Did we have a discussion or not?
Sir, please explain again.
Okay. So, A is the sound when the consciousness moves outward through the senses and touches the object. That movement of consciousness was created by this sound. I actually asked this, no? What is in your day-to-day activity? Can you tell me a scenario where you, without your awareness, produce the sound ah? Can anyone tell me?
When we get hurt,
Yeah, when you're hurt.
Pain. This pain.
If I come and prick you, you will say ah, ouch, ah.
Natural response.
So there is a sound ah, because in a spurt your consciousness is moving to the touch sensation. Any other scenario you produce the sound ah?
feeling relieved, or when we're sad.
Frustrated. Yeah.
Happy.
Surprising situations, exciting situations.
When we are
Excited.
tired, then also we do that.
When we?
When you're tired, like that, we do
So
it.
your energy, if somebody, if you see, you would have seen the weightlifters when they have to lift the weight, they cannot put enough effort. They put it is not enough. They want to really put it. So this is the way that your energy moves out in a spurt. Your consciousness is drawn towards a single external stimuli in a strong spurt. Sound is ah. Then when do you, unknowingly produce this sound?
When we are not sure, then
Thinking, wondering.
Yes.
When we eat something tasty.
Yes. Yeah. Yum. Yum also has Brahmari. Yum. Yes. See, you eat something, you want to absorb it, feel it. Amazing. And when a mother makes a baby sleep, correct? Even baby also does that. Makes them sleep. They don't do no, they say sleep. So ma is when you are withdrawn inwards. You want to go inside and find something, or just take a deep rest within yourself, or you want to deeply absorb something within you. If somebody is talking and you are absorbing everything, then you say, yes, I'm taking. Whatever you say, I'm taking inwards. Ah is out. Is in. So then oo, what happens with oo? When do you
Who is somewhere in between, sir?
हाँ, डे टू डे लाइफ में कब हम वो शब्द बोलते हैं?
When we get an insight, oh, acha.
Oh, yes, good. Yes. And see, the way I told you to chant oo is na it is this kind of See, if I have seen this person a few months ago and I remembered his name, but now I am not recollecting. I say, yeah, I know you. What is your name? This is the real oo. Like?
State of confusion.
It is a state where you are churning your mental world to find out something. So you are projecting
Like when
your
you're
conscious-
organizing something.
Yeah, you mentally, you are projecting your consciousness into your mental world, and then you are organizing something and finding out something. So you are projecting your consciousness in a mental space. So I project my consciousness in external space, it is ah. If I project it in my mental space, it is oo. When I project it neither outside nor in mental space, but inwards, then it is ma. So fundamentally, this is the core of the whole, actually, the whole course. If you understand this, instantly you become a yoga therapist. According to yoga, all psychiatric disorders are caused because of the imbalance in the movement of consciousness. either in the domain of A or U or Ma. People where there is excessive movement in the A become more prone for anxiety, impulsivity, hyperactivity. People where it moves excessively in Ma gets depressed. People where it moves excessively in U get deluded or get into psychosis. In fact, if you look at the classification in psychiatry, my dear friends, there are these three domains. This triple point of consciousness, this is my favorite concept that comes in Mandukya Upanishad. So all of you, in your 8th standard, there was a chapter, states of matter. What are the 3 states of matter, my dear friends?
Solid, liquid, gas.
Solid liquid gas.
Solid, liquid, gas. Correct. And you are also
Solid, liquid, gases.
Are you also aware of something known as triple point? What is the triple point of water? Go back to your physics lessons.
Boiling, freezing, right? Like that.
Yeah. See, at 365 Kelvin, pressure. One is volume, other is pressure. Temperature and pressure. If you keep changing them, the matter can change its state. Say, for example, if on the y-axis there is temperature and x-axis there is pressure. If you are changing the temperature from say normal room temperature 50 degree, if you go below 0, water will become ice. If you go above 100, water will become gas. If you keep the temperature constant but change the pressure, then also it will change the states, same states. So the point, there is a particular point at a temperature and pressure where you can say that if you move water even little bit to the right, it will change the state. Little bit to the left, it will change the state. But at that particular point, you cannot say that water is either solid or liquid or gas.
Equilibrium, right, sir?
Equilibrium. It is just one point. Every matter, every substance in this universe has this triple point, where the substance is neither solid, nor liquid, nor gas. This substance, in this position, it is called as the triple point of that substance. Yoga understands this triple point as the point of creation of that substance. Point of creation of water is the triple point of water. At triple point, water is neither solid, nor liquid, nor gas, because it has properties of all the three together and something beyond. In the same way, our consciousness has Jagrat Avastha, that is wakeful, dream Avastha, that is Swapna, and sleep Avastha, that is Sushupti. And Om is the triple point of consciousness. Therefore, it is the point of creation of consciousness. And that is why Om, no matter which disorder you suffer from, Om takes you in the equilibrium and then beyond. This avastha is known as Turiya. This is also another way to understand Samadhi. In Samadhi, you are in a wakeful, dreamful sleep. Can you imagine? Can you imagine a state where you are in a wakeful, dreamful, deep sleep, completely alert, but as if you are in a deep sleep? Everything that is real to you now appears like a projection in a dream. So that is something that can give you an idea of Samadhi. I will share the class on Samadhi also with you, but that will not be in the exam. So I am saying that there are these 3 spectrums. Actually, in psychiatric disorders also, if you see, there are these 3 spectrums. One is known as the hyperactivity impulsivity spectrum, which goes with A. Amotivation, social withdrawal is another spectrum that goes with Ma. And loss of touch with reality, There are certain people, they are dreamers. For them, the favorite pastime is you give them free time to build their castles in their dream. वो उनके सपनों की दुनिया में उनको छोड़ दो, उनको कुछ नहीं चाहिए. So these are U dominant personalities. So there is a tendency to lose touch with reality. Now, Om brings you in the center and then you transcend it. That is, these are externalizing disorders, these are internalizing disorders, and these are psychotic disorders. The whole of psychiatric, hundreds of disorders and their classifications can be put into just one simple category, that is externalizing, internalizing, and psychotic. All diagnoses are covered. Why all diagnoses are covered? Because fundamentally, they are errors in the movement of the consciousness. And yoga is a natural science to bring balance in that aspect. Therefore, yoga works in the very depth of the consciousness. So,
Sir, do you think, like, if a person is, like, while tamas, you said there are two categories, one is withdrawal and one is a destructive nature. So the other category, destructive nature of tamas, it will come under which one of this?
So he is combining the externalizing with psychotic. You understand, no? Whereas there is another aspect of depression where who is simply makara, who is internalizing. You understand? So tamas is of two types. One is externalizing and psychotic, and other is internalizing. So that internalizing person is a sattvic kind of a person. So this is
what called like the internalizing is depression, like the person when he's in depression, and when it is the other category, externalizing and psychotic, so it will come not in under depression, right?
No, they will go into this, you can call them as,
Personality disorder.
antisocial personality disorders, or those kind of traits they will go to. Personality disorders. There are different kind of, there are tendencies. Narcissistic also can go there.
Okay,
So,
sir.
so here, you have to see that yoga is about metacognitive awareness of these gunas, and this is what is the purpose of all the modules that we are doing. If in depression people are more internalizing, we are trying to enhance the domain of A and U. Whereas if the disorder is characterized by more of A, we are enhancing the domain of Ma and U. So yoga increases the opposite. Yoga doesn't suppress anything. Yoga increases the opposite. So one way of doing that is the sattvic, rajasic, tamasic personality that I told you. Another way to look at it is right from the consciousness domain and bringing a balance in. First, you have to understand whether this is a A dominant personality, this person is a A dominant personality, or U dominant personality, or Ma dominant personality. And if I know that, in fact, we have developed a questionnaire, which if you fill it up, you will know how much percent of Akara you have, how much percent of Ukara you have, how much percent of Makara you have. That is also there in your syllabus, and I am going to, cover that. First, I have to introduce you in the next session. When we are together, we will do that. So yes, Nikita, what did you want to ask?
Sir, please correct me if I'm making some wrong connection here. So when you say ki there is akara, makara, yukara, plus there is rajas, tamas, sattva. So I believe the concepts are regarding rajas, tamas, and sattva are common with Ayurveda as well, right, for body?
Yes.
So why I'm asking you this question is because as a mental health professional, I have been told by, in Surat, I have heard people saying कि psychiatry में ही इनका solution है. But when there is imbalance, there is no solution in homeopathy or Ayurveda for the same, the alternative medicines.
किसका solution?
Sorry?
Solution for what?
It's not solution, but some sorts of treatment which are there available for psychosis or any form of other mental health issues in psychiatry, but there is they never come on same page ki haan bhai homeopathy can also deal with it, or Ayurveda can also deal with it. And since when we speak so in depth and try to understand the concepts in yoga, So, is there any, helpful options for treatment for mental health in Ayurveda as well with this concept?
Definitely. See, basically, all these understanding emerge from Vedas. Ayurveda emerges from Atharva Veda. This understanding comes from Mandukya Upanishad, which is there in Rig Veda. So these are Vedic fundamental concepts. So there will be an harmony, in yoga and Ayurveda always. The Ayurveda basically looks into it from the environment and body perspective. Yoga looks more from the energy and mind perspective. So Ayurveda covers the Annamaya Kosha aspect of it. Yoga covers and some Pranamaya also, like they talk about Vata. Their Vata is our Prana. Okay. And then yoga takes it from prana to manomaya. Ayurveda doesn't go in lot of depth into manomaya, but Ayurveda recognizes that there is the three gunas of sattva, rajas and tamas, and there are three doshas of vata, pitta and kapha, and both of them have the fundamental basis in 5 basic elements: air, water, earth, fire and space. Okay. But yoga also goes into very subtle domains of these consciousness, and tries to bring a balance. See, modern medicine is required in psychosis because these people should be able to remain in society. Otherwise, they can't live, and earlier days there used to be asylums and all. We have been able to come out of that situation. Now psychotic people can stay among us only because of modern medicine, But what modern medicine does is there is aggression and those aspects are blocked. But apart from that, there are other overall improvement in quality of life, that insight that has to come back, their negative symptoms where they are withdrawn, that they want to, those aspects are not addressed by any medicine. It is here that yoga and Ayurveda come and bring that quality into the life of the person. But you need those drugs to manage emergencies of aggression and those kind of problem. And some, I will be frank, we cannot manage psychosis without modern medicine. And we should not try that also. We should use modern medicine and we should not tell patient to give up modern medicine, especially in psychosis. And yoga and Ayurveda should be added to reduce the side effect of antipsychotic medicines, which make them obese, and the risk of diabetes, metabolic syndrome, they increase. Cover those side effects, enhance their quality of life, functionality, and also you can also use yoga to reduce negative symptoms, Ayurveda to enhance sleep and other domains. So therefore, it is an integrative approach that helps. But in depression, yes, mild to moderate cases, only yoga is sufficient. So in an evidence-based way, we have to go forward. But this understanding is actually the very fundamental basis of yoga therapy. All of you enrolled in this course, Basics of Yoga Therapy for Mental Health Professionals. This is the class for you. This is what is the real core of the yogic science. All the modules that you will see are actually working on this. You look at the depression module, you look at the stress module. Stress module tries to bring a balance in all the 3 domains. Depression module is considers that the problem is internalizing, so they are making them more externalizing, chanting A after each practice. And chanting A, U, Ma at the end means bringing them in the center. Metacognitive awareness. The postures are such that are chest opening, that should energize and increase their rajas. Their left nostril is more activated, so we close the left and only do the right one. So there is a proper science, proper logic through which the therapy can be planned.
Thank you, sir.
Krishna also talks about the balance in the lifestyle, which is very, very important in this population. So who can live yoga? Who can come to this middle? Metacognitive awareness is not something that you will think and it will come. For that, you need to have a balanced lifestyle. Otherwise, your mind will always be drawn on one side or taken away by A, U or Ma, one aspect of consciousness. So Krishna says in 6th chapter of Bhagavad Gita, Na ati ashnan astu yogoho na cha ekantam anashnatah na cha ati swapnashilasya jagrato chaiva na Arjuna. So he's saying, Arjuna, those who eat too much or eat too little, sleep too much or sleep too little, all those people cannot achieve success in yoga. It means their mind will not be in a position to come to equilibrium at all. They will always be biased. So they are not fit for developing that metacognitive awareness only. So therefore, for yoga, we say that, okay, after 2 hours, you should come, and previous night, you should have a good sleep. Then you will be able to be mindful in yoga. And that is why we see a lot of people who go to gym and all develop MI and other thing. It is because they don't take proper rest in the night, and next day they just stress their body by doing excessive exercise. So, but for those who are balanced in their eating, do not eat too much, do not eat too less. Those who are balanced in their work and rest. You should work also, you should rest also. And regulated in sleep. Such people, yoga comes naturally to them, and yoga destroys all their sorrows. How does yoga destroy sorrow? It takes you into the avenues, into the dimensions where your very definition of who you are changes. And that is why your sufferings are also gone. Okay. So this you all know, Bharat already spoke about it, that we found differential effect of each domain of these sounds. And this is what, somebody was talking here, that age-wise, was there anything, So we saw that with yoga, the shrinking of the gray matter of the brain was much lesser if people had at least 1 year of experience of practicing yoga before. But naturally, you see, as the age progresses, the effect of yoga also becomes less and less, because the person doesn't have enough prana shakti within him left. So the younger you are, the earlier you start, the more benefits of yoga you can obtain. But definitely it is never late for yoga. You should do it. But if you are talking about the thickness of the gray matter and all, the earlier you do, the more benefit you will obtain. This is what already has been discussed. So we have developed these yoga modules. There are these scientifically developed yoga modules for different conditions. When we were developing yoga module, we look at whether that disorder is a disorder that is increasing his vata, pitta, kapha, whether it is increasing his sattva, rajas, tamas, and whether it is increasing a imbalance in a, u, ma, and then add component based on. So for us, the name doesn't matter. For us, what matter is every disorder will show some imbalance in dosha, some imbalance in guna, some imbalance in a, u, ma. Our approach is balance the dosha, balance the guna, balance the mode of the consciousness. You bring balance, then you can design module for any condition. You do not even need the diagnosis. You only need symptoms. Okay. So this is what we have been doing. In depression now, quickly look at the evidence. 34 randomized control trials, my dear friends. Much more than you can see in even antidepressants are not explored that much. But very quickly they come into market. In yoga, we keep on showing evidence, but it doesn't come into the clinics of the people. So 1200 more than patient, 48.5, and lot of meta-analysis also concluding that yoga works. Now what else do? You keep on doing trial, you keep on showing yoga works. Now clinicians don't include it in their clinical practice. How many psychiatrists have you seen who teach yoga for depressed patients? So it means people were asking, you should generate evidence, generate evidence, generate evidence. We have generated evidence. Now I think we have to generate awareness of the evidence. Even after generating that, it is I think it is the tamas of the physician. What else? I feel very angry about it.
Sir, situations when yoga doesn't work for depressed people, is there any situation kind of?
See, everything that is there, depending on the phase of the illness, you have to see. If it is very severe, as you saw in the case report of Soumya also, yoga couldn't work there. She was very severely depressed. She required antidepressant, but when she became better, it worked. And it may be little far-fetching, but I believe that yoga will work in every patient, because fundamentally the error of consciousness and the purpose of life is something which is addressed only by yoga. So I believe that if your understanding of yoga is proper and you do not think that yoga is simply asanas or pranayama, if you understand yoga in its depth, then yoga will work for everybody. Yeah, it may be slow depending on what kind of clouds, what kind of density of those clouds person is carrying, but yoga will be able to thin out those clouds with time. I believe that. That is why yoga has worked. In our philosophy, whoever was depressed, yoga worked and that person evolved and contributed to the science. So, see, 50% of these are women. And if you look at the evidence, this I'm talking about yoga as only the module. No philosophy, no theory, no talk therapy, only module. 2 weeks to 28 weeks is the average duration. And on an average, you can expect the result which will come in 10 weeks. No matter how, the kind of, you can say, the patient is, but only mild to moderate severity, not severe patient. And not very elderly patient. These are all young people. So yoga can improve depressive symptoms, anxiety symptoms. Patient with MDD has a safe and wide patient acceptance. So this is a systematic review published in 2023. So this is the forest plot. All the studies, only one study was little neutral. All the studies show positive effect. There is no trial of yoga and depression either done in India or done abroad, which has shown that yoga did not work. There are trials with antidepressants also where many trials show they did not work. But yoga is working and much faster than antidepressants. See, and the more the yoga, you can see that there is a forest plot. More studies have been done where high frequency yoga was used and low frequency. So even the frequency, if it is less, then also the benefits are there. Sensitivity has showed the combined effect size of 0.6, which is better than any antidepressant. And the module you are already aware of, that what we focus on backward bending poses, faster breathing practices, right nostril breathing. And it is a very, very fundamentally from the consciousness to the manomaya kosha, to pranamaya kosha, to annamaya kosha. We work at all the koshas. That is why it works. Okay. So this is what I wanted to share with all of you. Now there is no time for practice session today, but I think it was very important. And we were going to repeat the same depression module, which you already have. And so I now end my class and stop recording.